I'm Dr. Sallie Sarrel, a women's health pelvic specialist in physical therapy. Somebody asked me yesterday what were the symptoms of pelvic floor dysfunction. So I thought I'd take a few moments here in my home office to help everybody out. Before we get to what pelvic floor dysfunction is, it's important to understand what the function of the pelvic floor is. The pelvic floor's function is to serve as a structure which closes the pelvic outlet, which is basically the holes at the bottom of the pelvic floor, at the bottom of your pelvis in women. The pelvic floor is made up of major structures. First, the bones of the pelvis or the pelvic girdle. Second, the pelvic floor muscles. Third, fascia and ligaments. And fourth, the viscera of the pelvis is also part of the pelvic floor. So there's something called pelvic floor dysfunction, and there's also something called pelvic floor muscles. A lot of people like to use them interchangeably, but it's important to know that the pelvic floor is normal. We all have a pelvic floor. It's made up of lots of structures, which I just listed. Some of us have pelvic floor dysfunction, and we all have pelvic floor muscles. Now, the pelvic floor muscles have this main star. It's called the levator ani muscle group, and it's made up of 4 muscles that basically run like a fan from the pubic bone back to the coccyx, which is that tiny little bone at the bottom of your sacrum down by your tush. So, since we all have a pelvic floor, not everybody has pelvic floor dysfunction. So the technical definition of pelvic floor dysfunction is a loss of function and the integrity of the connective tissue and the muscle fibers of the pelvic floor. How do you know if you have pelvic floor dysfunction? Well, some of the symptoms are urinary and fecal incontinence, urinary dribbling or leaking, fecal dribbling or leaking, sexual pain or dyspareunia, pain after or during sex, back pain, centralized lower abdomen pain, obstructive defecation or obstructive urination. So you have to push to get out. You can't get either urine or stool out, and you feel like there's actually something preventing you from voiding. You can have pain with sitting. You can have pelvic pain with standing. You can have coccyx pain, so pain at that little teeny bone, and also you can have a deep sensation of tush pain or behind pain. So a lot of women who have pelvic floor dysfunction, they only sit on one side of their tush. They always have a half-ass night. That's how it is, because the floor is in so much spasm and there's so much dysfunction there, they have a lot of discomfort. So what do you do if you have pelvic floor dysfunction? Well, the first thing to do is to go check in with your OBGYN, because things like urinary and fecal incontinence could come from something other than pelvic floor dysfunction. Sexual pain and tush pain certainly could come from endometriosis, so you want to have a discussion with your doctor if that's part of everything. Also, sometimes ovarian cysts cause many of the symptoms that I listed before. But once you've ruled out any of the causes that your OBGYN thinks are imperative to treat right away, it's important that you find yourself a very good women's health certified specialist in physical therapy. And this specialist will do a full evaluation and look at those things that we mentioned, the bones of the pelvic girdle, the fascia and the ligaments. Many of them are trained in visceral manipulation to look at how the viscera itself is moving and grooving. And also, they can do a full manual evaluation of the pelvic floor muscles. I'm Sallie Sarrel, a women's health physical therapist, and I'm hoping you're having a great day and a happy pelvis. Take care.